So, you're just about to dive into your MSK placement and you want some tips to get you started. Well, that's where we come in. Let's get clinical. Hey guys, Khalid here. Welcome back to Clinical Physio. So here are my top 10 tips for starting your MSK placement. And top tip number 1 is get in touch with your supervisor before you get started. Now, this can be via email or over the phone, but I try and tend to encourage students to speak to them on the phone if possible, just because it adds a really nice personal touch to things, and you can ask so much more once the conversation gets started. What kind of things do you want to be asking? Well, really, you want to try and find out what the environment you're going to be working in is all about, so that you can refine and focus on what are the key things for me to look at before my placements get started. So, what kind of conditions do they see the most? Low back pain, osteoarthritis, tendinopathies? Do they work with orthopedic referrals so that they're seeing post-fracture patients or post-surgical patients? Again, this can also give you the chance to ask any particular resources that I should really dive into before you get started. But don't go crazy. You're not a machine. It might be that you've just come back off another placement or you've just finished a really major assignment. So I wouldn't expect you to go through all of MSK and then get started on your placement. Hopefully that phone call can help you focus on what are the key things. So top tip number 2. Probably my most important tip when it comes to MSK, learn your subjective and objective assessment off by heart. It's so important. And so I've put my subjective and objective assessments on the screen for you to see here. Now, do you have to learn my exact order? Absolutely not. But you must learn an order that works for you and an order that you can remember. Because it's absolutely so mentally exhausting when you're sitting there with your patient and you're constantly having to think, what question do I ask next? Or what test do I do now? It means that you can't actually focus your brain power on what the patient is saying or what the patient is doing or presenting like on your testing. So make sure you learn an order so you can build your confidence and make sure you can actually think about what's going on. Top tip number 3. Definitely practice your neuro assessment before you go on placement. There's no getting away from it. Your neuro assessment is probably one of the things that students worry about the most on placement. Having to do myotomes, having to do dermatomes, having to do reflexes, and understanding what it all means. So make sure you get plenty of practice before you go on placement. Grab your housemate, grab your friends, grab your family members. Make sure that you practice at home, make sure you practice at the practical rooms at your university. And of course, we have videos for you on our YouTube channel of upper limb myotomes and dermatomes, lower limb myotomes and dermatomes, and all the key reflexes you need to know. So make sure you get it done. Next, top tip number 4. People always ask, how much anatomy do I need to learn for my placement? The answer is, you don't need to learn everything. But where can we get started? First of all, learn the key muscles, the key bones when it comes to each individual joint. And then, of course, some of the key nerves that pop up time and time again, and the key blood supply that comes up time and time again for those different joints. One of my other big tips when it comes to anatomy is thinking about level 1 anatomy and level 2 anatomy. This is a bit of a phrase that I made up, but to me, it really makes sense. If you're trying to remember anything, if you're trying to learn anything in life, do you try and learn the hard version first or the easier version first? Well, obviously the easier version, but the challenge with anatomy is that all the textbooks lay out all the really complex hard anatomical terms, and we always think, right, I've got to learn them. Think about it slightly differently. For example, supraspinatus muscle. Instead of having to learn that the origin is the suprascapular fossa of the scapula and the insertion is the superior facet of the greater tubercle of the humerus, why don't we just remember that the origin is the superior scapula and the insertion is the proximal humerus? That's where we can start with. That's level 1 anatomy. Then, when we get better and more confident at all of that, then we can think about level 2. Just a way of being able to make sure your anatomy learning is a little bit easier. Top tip number 5. When you're asking your red flag questions, ask more than one question. So, let's say, for example, you have a patient with low back pain and you want to rule out cauda equina syndrome. So, you ask something like, have you had any difficulty passing urine? And your patient says, yes. Now, apart from completely freaking out, our next step is to ask more questions so we can actually determine, is this really quad equina syndrome, or actually is it something else that isn't emergency? So, for example, you might ask, can you tell me a little bit more about this problem? What actually happens when you try and pass urine? Is this something that's happened just the once, or does it happen all the time? How long has this been going on for? Is this a brand new problem, or is this an old problem? Has this been investigated in the past? Have you spoken to any other clinicians about this? Hopefully, you can imagine that the answers to these questions gives us loads more that we can work with to try and truly rule out, does our patient have quad equina or something that's not an emergency? Now, with all that in mind, this brings me on to red flag pathology, and that is part of top tip number 6. Top tip number 6, check out Clinical Physio membership. Now, I might be biased because I'm on the team, but I have to say it's an absolutely amazing resource. There's hundreds of pieces of content on there that can really help with your placement. For example, our webinars on loads of different subjects such as cervical spine red flags, lumbar spine red flags, subjective assessment, differential diagnosis, exercise prescription, loads in there, loads of brilliant video tutorials for you to watch. But also, we've got a huge library of loads of different MSK conditions that give you the really key information. What are the signs and symptoms of this condition? What are the key assessment markers? How do I treat this condition? And with our Clinical Physio membership app, all of these are in the palm of your hand on the phone. So when you're just about to see your next patient, you can quickly check what you need to do and how you can help them when you look at that condition. So if you want to check out membership, link in the description below, it's well worth a look. Top tip number 7, plan your no patient time. What I mean by this is that there are going to be times on placement where you don't have a patient. Maybe you've had a cancellation, maybe you've just had an empty slot, and therefore plan what you're going to do in that time. Speak to clinicians beforehand and say, if I've got a cancellation today, can I come in and sit with you? Watch what they do, see how they do things, how they communicate with patients, how they assess and treat. Are there classes going on that you could get involved in to develop your skills in leading a group? But making sure that you actually plan that ahead of time means that you don't end up just sitting there twiddling your thumbs. So plan what you're going to do. Top tip number 8, practice reasoning out loud. Now, what I mean by that is don't be afraid to voice your clinical reasoning with your supervisor. Sometimes you might get it right, sometimes you might get it wrong, but ultimately you really allow your supervisor to see what you're thinking, which is crucial to them understanding your knowledge and your skill levels. I've been a supervisor in the past, and I can honestly say that when students actually communicate with me or give me an idea of what they think's going on, it's really impressed me. I've been able to see, wow, I didn't realize that they knew that. I can really see what they're thinking there, which absolutely demonstrates the student's worth compared to if they didn't communicate with me. Then I would have far less of an idea about their skill level. So don't be afraid, give it a go. Top tip number 9. Practice talking to patients. We know now in MSK Physio that communication, what we say and how we say it, is incredibly important to the relationship with our patient, but also what our patient then takes home with them, how they feel about their condition, how they feel about their belief on how they can manage their condition. And so one phrase that a brilliant physiotherapist, Brad Skanes, always taught me was interaction over intervention. Learn how to interact with patient, learn key skills in communication. It really makes the difference in your education, your advice giving, and your reassurance, and makes a massive difference to patients. And top tip number 10, reflection. We talk about it all the time when we're studying, but it is really, really true. Writing things down, emptying your brain at the end of each day or at the end of each week really allows you to process your thoughts. It means that you can go into a fresh week with some ideas, maybe some goals about what you want to achieve that week. And I think the real difference here is when people are struggling on placement. Then, when you keep things all in your head, it makes it much more difficult for you to move on, for you to move away from them. Whereas actually getting them down on paper, or perhaps even speaking to someone about it, allows you to come up with some solutions to make it better for the next week. So don't be afraid to reflect. So those are our top 10 tips. If you've enjoyed this video, smash that like button and subscribe to the channel for loads of our videos on different objective MSK assessments. And of course, as we mentioned earlier, do check out Clinical Physio membership in the description below. Hundreds of resources that can really help you as a clinician. My name's Khalid. Thank you so much for watching. See you soon here on Clinical Physio.